Welcome to the Blue Jacket Fashion Show. Fashion show. Fashion show. Blue Jacket. Blue Jacket. Fashion show. Blue Jacket. Fashion show.
Hello and welcome to the Blue Jacket Fashion Show. My name is Frederick Anderson, and along with my partner Laura Miller, we want to welcome you to the 5th anniversary of the Blue Jacket Fashion Show. Every year this coincides with New York Fashion Week, and this year we land right on World Cancer Day. The Blue Jacket Fashion Show is a yearly event that brings together fashion, entertainment, health, media to discuss men's health and educating men on early detection, risk factors, and importance of early treatment and early detection of prostate cancer. First of all, we really want to thank Janssen Oncology for their support because they've been with us since day one. Now, on our 5th anniversary, we will continue to show you great fashion as we always have. And we've also assembled a team of leading medical experts, researchers, survivors, and fashion designers who will discuss the importance of educating men on early detection, testing, and to also, the most important, get treatment. And now I want to introduce a really great friend of mine, Mr. Mario Cantone. You've seen him on Sex and the City and a million other things. He is literally the funniest man alive. And he has such a great story about his kind of connection to prostate cancer. And he was also the very first person to walk and say he would do our Blue Jacket runway. Mr. Mario.
My bedroom, welcome to my bedroom. Hey, yeah, this is where the magic happens. And this year, I'm wearing Stephen F., who is an incredible designer. F is for fabulous and fantastic. He's in New York City, and I've got this beautiful, like electric cobalt blue suit on that I just absolutely love. So thank you. So that's, and my personal story with this whole thing is, you know, my father passed away of prostate cancer in 1996, December of 1996. So he suffered with it for about 6 years. He was diagnosed in 1990, and they didn't catch it too early. And, you know, they did everything they could. And so it's very close to my heart. And now that I'm getting older, you know, I just, you know, I'm very aware. I get my PSA done all the time. I get things checked out because I'm a hypochondriac, and I'm older now. So it's something you need to do. You need to go get checked as you get older, you know. I'm looking forward to next year when we get to all be together again, because this has been pretty difficult. Yeah, but it's okay. I'm a bit of a recluse anyway, so I've been handling this well. But I still get my prostate checked, no matter what. Pandemic or no pandemic. I get my checkups and get my prostate checked. So check your prostate, boys. Can't do it yourself either. You got to go someplace. You got to go to a doctor.
I'm here today with Dr. Kelvin Moses, a professor of urology at Vanderbilt University. Dr. Moses, thank you so much for taking time to talk with me today about prostate cancer. And
thank you. Thanks for having me.
Yeah, I'd like to start by asking you to talk about your experience with prostate cancer patients.
So at Vanderbilt, I lead a team called the Comprehensive Prostate Cancer Clinic. And within that clinic, we see men with advanced cancer or metastatic prostate cancer who need specialized treatment, usually beyond the standard treatments for localized cancer or cancer that's just within the prostate. A lot of these men presented initially with advanced disease or disease that has spread. And so one of the things that we hear a lot is that they wish they had gotten screened or could have gotten detected earlier, because a lot of these treatments require a significant amount of work and have a lot of side effects.
So it sounds like you're hinting at early detection is paramount. And why do you think it is that in certain situations you don't have people who come in early enough to detect the disease and prevent what could have been a better outcome a lot of the times?
Yeah, great question. I think one of the issues is that there has been a lot of controversy about screening, particularly on the primary medicine, primary care side. Early on, there were data that suggested maybe there was more harm with screening than good. And so a lot of men did not get screened over the last decade. Those recommendations have been updated. And so now we're seeing, again, an uptick in screening. But one of the populations that has always been less screened is Black men. And because of that, Black men have been more likely to be diagnosed with higher stage and higher grade disease, essentially more advanced. And because of those screening discrepancies or disparity, you see a disparity in the type of cancer that Black men present with, and then really a very glaring disparity in death from prostate cancer. Black men are more than twice as likely to die from prostate cancer compared to all other populations in the United States. And so that's why I really like to emphasize, for the appropriate man, someone who has good life expectancy and understands what screening is, they should get screened because if they do have cancer, it could be caught at an earlier stage and then get treatments, potentially with fewer side effects or complications.
So if I'm hearing you correctly, you're saying everyone needs to get screened early, and there is a particular concern to make sure that Black men are screened as early as possible. At what age does screening usually start?
Somewhere around 45 to 55 is where men who are of average risk, meaning that there's not really a strong family history, or if they're not African American, to start speaking with their physicians about what screening is, and that's called shared decision making. For Black men and for men who have a first-degree relative, such as a father, brother, or son with prostate cancer, all the screening guidelines scale back a little bit to somewhere around 40 or 45 to start screening.
And there is some good news in that prostate cancer, I've always heard, is one of those cancers that grows relatively slowly compared to others, and the life expectancy, the survival rate is actually quite good compared to most cancers. Is that correct?
That is correct. So, and that highlights the importance of screening. So if it's found at an early stage, survival is really 99, 100%. And when we talk about cancer survival, it's usually in terms of 5-year or 10-year survival. And for prostate cancer, localized disease, or even if it spread to the lymph nodes, it's still around 99, 100% at 5 or 10 years. It's that late stage, the metastatic disease, where it drops off, and that 5-year survival drops pretty significantly to about 20 to 30%.
Can you talk a little bit about cancer treatments and how that has progressed and improved with prostate cancer over the years?
Absolutely, and that's really some of the exciting research that's been done. For the localized treatments, there's always advances to try to improve the outcomes as far as sexual and urinary function and reduce complications. And then for men with more advanced or metastatic disease, really the last 10 years has been just a light years forward as far as the types of treatments that are involved, not only hormonal treatments and chemotherapy, but immunotherapy and other sort of less invasive or fewer side effect treatments that are available for men and really have improved survival. Some of the disease that I see, 10 years ago, men didn't last 6 months or a year. And now we're getting 2, 3, 4, 5 years with metastatic disease. And so it's really been a pleasure to help these patients because they do have so many more options that help with helping them live longer.
Right, right. That's so fantastic. Well, Dr. Moses, thank you so much again for taking time to speak with me today. And I also want to thank you during this unprecedented time, you and all the doctors and nurses and medical staff out there. You guys are true heroes, and we couldn't get through what we're getting through right now without you. And we're just very, very grateful to you. So thanks again for helping us talk about prostate cancer and prevention of prostate cancer. And I just wish you the best. Thank you so much.
Thank you very much. I really appreciate you taking the time with me.
OMW, on my way to you. Good at what I do. I'm OMW. OMW.
So this is a Nick Graham. Oh, this? I throw it on when I don't care how I look. Nick Graham has become a friend of mine now, everybody. Nick Graham's the guy who invented Joe Boxer. And that was a very successful brand. And he now is designing his own clothes, and these are Nick Graham clothes. Here's the thing, you guys. They just fit me. Prostate cancer is a serious problem, but we can address it through science. And, you know, we have prostate cancer that's been addressed through medical science. We have the coronavirus, which is being addressed through medical science and the science of public health, which involves a lot of math. And professionals have figured this out. Be safe out there, everyone.
OMW, on my way to you. Good at what I do. I'm OMW.
Hi, Blue Jacket. Guess what? I'm at work. I'm wearing my favorite blue jacket, a blue coat and my blue suit jacket. And it's what I'm gonna wear on here tonight. And let me just say, congratulations on 5 years of doing amazing things. I love being a part of this every year. So thank you so much. And everyone get tested. You better work.
I'll give you something to believe.
Hey everybody, it's Mike Woods from Fox 5's Good Day New York, and I'm here with Robert Ginyard. He's the chairman of the board of Zero, the Inn of prostate cancer. So let me tell you a little something about the Blue Jacket Fashion Show and what we have on. So you have your jacket, and I'm seeing it's looking snazzy. You got the whole get up, right?
I feel like $1,000,000. I'm wearing the Tommy Hilfiger, and you know, it just fits tight like a glove. I am on fire right now.
On point. I got mine from Men's Warehouse with a nice turtleneck sweater underneath. And I got to tell you, I worked with the folks from Men's Warehouse last year. And that is actually one of my most liked photos on Instagram from last year, from the entire year, I have to say. So get ready for some attention in that bad boy, if you know what I mean.
I am looking forward to it. I'm going to post it. And, you know, and the first person I'll send it to is I'll send it to you, Mike.
Robert, this is your first time that you've been involved with the Blue Jacket Fashion Show, and I'm sure prostate cancer had a major impact on your life. How has it had impact on your life in particular?
I was really inspired to get involved because of my journey. I was diagnosed with prostate cancer at 48 years old. And at that time, I just had my first child, and then the second one was on the way. And you know, just to get that news about prostate cancer was just really devastating. And, you know, quite frankly, Mike, I thought I'd never talk about prostate cancer again. My goal was to get treated, get over it, and go hide in the closet somewhere and never tell anybody about it. But
not the thing to do though, right?
No, it wasn't, Mike. And my spirit really convicted me to get out and tell other men about my journey, and then, you know, my treatment options. And so I think, you know, it's incumbent upon all of us who have gone through this journey we get through so other people can get through. And so that's been my motto.
Well, I'm telling you what, you're doing the right thing. This is only the second time that I've been involved with the Blue Jacket Fashion Show, but this is an amazing event and organization. So you're doing the right thing. And I thought very similarly, because I was just diagnosed about 3 years ago. And oh boy, it was a rough journey into it, but it has changed my life in big ways. But now, how did you find out that you had prostate cancer in the first place? And how did you take that diagnosis?
Well, I found out through a normal doctor's visit, my annual doctor's visit. And each year I get my exam, and my wife would always say, make sure you get your PSA. So gentlemen out there, by the way, listen to your wives. And so my wife said, make sure you get that taken care of. But I'll be honest with you, Mike, what had been happening over the years, my PSA had been rising in small increments. And, you know, because I've had a doctor for the last, I want to say 30 something years, we had such a relationship, and he monitored me for a while. And then it got to a point where he said, you know, I'm not happy with where your PSA levels are climbing to the levels that they kept climbing to. He says, at this point, I want to have you go get a biopsy. And sure enough, after the biopsy was done, I found out that, of course, that I did have prostate cancer. But I think one of the things that helped me out, Mike, is that because I had such a great relationship with my doctor, that this diagnosis wasn't something that, of course, it catches you off guard, but I had my healthcare professional there with me, who knew me, he knew my body, he knew my family. And so he was also helpful in getting me to guide through or navigate the process of the next steps.
Well, that's great, because it definitely helps to have some support behind you, somebody who's either been through it, because a lot of times we'll go into this, we're flying blind, so to speak. I just so happen to have a big family history. Unfortunately, I lost my grandfather, my father, my uncle, all to prostate cancer. And one was, you know, from the cancer itself, and the other two were from post-surgery complications. But nonetheless, I knew that, you know, prostate cancer was something I'd likely have to deal with. Found out pretty much the same way. So yes, make sure you get that PSA checked, my friends out there, because it's very important. And again, it happens early. Sometimes it happens in your 40s, like it did to you. It's the same thing for me. I was 49, getting ready to turn 50. Regular PSA pretty much saved me, my regular doctor. So.
Mike, can I also add that, you know what, and this is common sometimes in the African-American community, but, you know, my dad didn't tell us that he had a bout with prostate cancer.
Oh, wow.
Yeah. You know, he asked my mom not to tell the kids because I didn't want them to worry about me. And sure enough, had I known that information years ago, it would have been, you know, really up on my radar screen.
I was happy that my family, we did pass the word along. And if it weren't for that, things could have gotten along a little bit further. I actually was diagnosed with prostate cancer 10 years earlier than my dad and grandfather and uncle were. So it actually came to me much earlier. So that early detection, if I had waited until closer to 60 to get checked, I would have had some big time problems if I had made it that far, because my cancer had already advanced quite a bit and gotten to the point where it was quite dangerous. So I think that's good info to put out there. Now, what message would you like to send to other patients who have been diagnosed with prostate cancer? Because I know a lot of folks have their own feelings. Maybe they're kind of, you know, down in the dumps, but what message do you have to them?
It is really important to have a good team around you, starting with your family, but your doctors. It's, you know, I think one of the things that really raises the anxiety level for a lot of men is that when they get diagnosed, they're kind of new and fresh to the healthcare system.
Right.
You know, now I've got to find an oncologist, and now I need to do all of these things, and it's so unfamiliar to them that brings on that additional pressure. So, you know, my thing is, for the healthy men now, make sure you have a doctor, you know, gather your team together so that, Lord willing, you don't run into prostate cancer. But when you do, you have a team that's ready to be there for you.
And the other thing with that is also, you, like myself, I think it's excellent. It's awesome that we get out there and help to support the other men that are going through this, because you have to have your team. But if you don't necessarily have somebody in place, it just helps to have somebody that you can talk to that's been through it. I think that makes a big difference as well. So again, I'm so happy that you and I and all these other gentlemen are out here. And the ladies too. You'll need the ladies that back you up, because they're the ones who make you go to the doctor, go to the doctor, do what you got to do. Thank goodness for them. They're the angels on our shoulders. So
indeed.
Very, very good, Robert. Well, it's excellent to meet you, and keep up the good work. You've been doing good work for a long time now. I feel like I'm the new kid on the block, but you're the new kid on the block with the Blue Jacket Fashion Show. But it's great to have you.
Thank you, Mike. It's been a pleasure talking with you. And if there's anything I can ever do on my end to help you, I'm here for you.
Same to you, pal. Take care.
Take care.
Hey to my friends, the Blue Jacket Fashion Show. Notice I'm sporting blue. I got a little blue behind me. Everything for you guys. I saved this jacket just in case Well, the tradition we've had for the last few years needed to change, and it did. So I've stayed at home, as you probably have. But this doesn't change the fact that we've got a big problem right now. We've got the most common non-skin cancer, prostate cancer. It's increasing exponentially with age. So we've got a lot we need to do to make sure that it's not hurting as many as Americans as it has. 99% of people, this is good news, who don't have a widespread disease actually live 5 years. And so all you got to do is find it early on. Now, if you got a family history, that's important, but you got to check in even if you don't have a family history. So after the age of 45, talk with your doctor. There are blood tests, there's examinations, there are things that can be done. In the meantime, cook some tomatoes with olive oil. Some call it pasta sauce because it's actually good for your prostate. Cruciferous veggies are great in general. Things like broccoli, which I love, but also cauliflower. And you know what? Green tea. Think about it. It's a great late night snack, and it's got some antioxidants that might be beneficial. In the meantime, happy 5th anniversary, my friends. I'll keep wearing my blue jacket as I think about you guys. I think you might like it. What side looks better? I might get you dizzy if I keep twisting. Take care, my friends.
Hey everyone, this is John Dempsey, and here I am in pandemic New York, celebrating the 5th anniversary of the Blue Jacket campaign. I'm personally wearing Alessandra Sartori XXX Zegna. I'm wearing one of my Zoom-ready blue jackets here with my trusted assistant, Bella, and a shout out to the amazing work that the Blue Jacket campaign does for raising awareness for prostate cancer. Get tested, be well, see you on the other side.
Hello, everybody. I'm Andre Leon Talley, if you don't know me, formerly a Vogue editor-at-large, Vogue creative director, currently author of a book, best-selling book, Chiffon Trenches, New York Times bestseller. I'm indeed humbled and honored today to introduce and speak with Dr. Jonathan Simmons, President and CEO of the Prostate Cancer Foundation, and Mr. Rodney Gillespie, Vice President of Oncology, Sales, and Marketing at Janssen, about the current state of prostate cancer. So my first question is to Mr. Gillespie. How are you today? How common is prostate cancer, and why should we pay attention to this issue?
Hi, Mr. Talley. Good to see you again, and thanks. It's a very important question that you're asking. Actually, prostate cancer is more common than most people know. In fact, it accounts for the second largest number of cancer deaths among men. And nearly 4 million men in the United States, and probably around 20 million worldwide, are actually living with prostate cancer today. And just to double click on those numbers a little bit, 1 in 9 men will be diagnosed with prostate cancer in his lifetime. And for Black men like us, the likelihood actually increases 79%, and we are twice as likely to die from the disease as white men. But the good news is, prostate cancer actually has one of the highest survival rates of all cancers, and it's 99% treatable, but only if it's detected early. So the more people we can reach with the latest information about prostate cancer, early detection, and treatment, the more lives we actually save. And the Blue Jacket Fashion Show is a great way, a very positive way to raise awareness.
What are the signs and symptoms of prostate cancer? Are some men more at risk than others, Dr. Simmons?
Prostate cancer occasionally has some symptoms, but most of the time, 9 times out of 10, you don't feel anything. So it's a symptom, mostly it's a symptomless cancer. If you don't get checked, it can grow unchecked. Symptoms of sometimes increased urination or difficulty urinating, and certainly blood in the urine or blood in the semen is a warning sign. But what's so important to understand is prostate cancer is a silent cancer. Short of getting checked, we can't really we really can't count on symptoms at all.
Mr. Gillespie, to you.
Yes, sir.
Tell us about the work that Janssen Oncology is doing for men with prostate cancer.
You know, the work that we're doing, obviously, is very important work for us at Janssen Oncology, but it's important not just for us to raise awareness, but also for us to make sure that we're supporting the action that is being taken and the change that needs to happen in the treatment paradigm for prostate cancer. We are passionate, right? We have a lot of passion about our mission to reimagine care and how people actually define their life with cancer. And we're also driven by the personal connection that many of us share with the disease. And over the last decade, Janssen has developed deep expertise in prostate cancer, delivering several first-in-class treatments across the treatment continuum. And we continue to put a lot of effort into research and development to find new ways to make sure that we're not just treating, but helping to prevent and intercept the disease in its early stages.
Dr. Simmons, what is your advice to someone who was recently diagnosed and to family members helping a loved one navigate a diagnosis?
They should go to pcf.org. PCF stands for Prostate Cancer Foundation.org. There's a patient guide, there's a guide for patients and families that has all the latest information on at any stage of diagnosis. And also there's really important information on how to change your diet, what kind of exercise you need, because prostate cancer is the #1 cancer that's really influenced by changes in lifestyle and diet. And all the new developments, including the important work of Janssen, the new kinds of medicines, it is written so that any patient, any family member could even talk to their doctor about what they read. We want patients to be partners in their care, and prostate cancer care is changing every couple of months now. So it's very, very important to stay informed at pcf.org.
What can one do to help prevent prostate cancer, Dr. Simmons?
We're still funding at our Prostate Cancer Foundation research in this area, but there are 3 things that we know will lower the risk of getting prostate cancer. One is exercise and a normal body mass index. In other words, obesity, being overweight, particularly getting into one's 30s, is a risk factor. So basically being heart healthy is being prostate cancer preventative. And the second important aspect, particularly for men of African descent, is to understand that prostate cancer is a disease that runs in families 57% of the time. Prostate cancer is inherited. So if you have a father or an uncle who's had prostate cancer, at 40, you need to see your doctor about basically getting checked. With prostate cancer in your family, or breast cancer in your family, or ovarian cancer in your family, or colon cancer in your family, a man being checked at 40 is a very important thing for men's health. Well, we're the world's largest foundation funding prostate cancer research, and over the last 20 years, we've lowered the death rate in the United States by 52%, according to the American Cancer Society. So we've led the research fight. So half the number of men literally in the United States are dying of prostate cancer as they were 20 years ago. And we're right now pushing a set of what are called precision medicines for men who have advanced prostate cancer, whose cancer has come back. We have right now over 30 new investigational experimental new treatments, including activating the immune system in clinical trials. So our foundation's job is to put itself out of business by 2030 with research, like literally put prostate cancer deaths out of business, and with that lower suffering. And that's why a partner like Janssen is so important, because as this research develops, as we've all learned from COVID, you need basically great pharmaceutical companies to step up and take the science and get it to all the people.
Rodney, this is Janssen Oncology's 5th year sponsoring the Blue Jacket Fashion Show. And I hosted the show last year, and I think it's a great cause that you are sponsoring. Tell us why this event is so important to all men.
Yes, Mr. Talley. And by the way, you did a fabulous job hosting last year.
Thank you.
It was amazing. You helped bring it to life, which is really, I think your passion that you showed is exactly the same, passion that we have. And so we're really thrilled just to be a part of this again, to really host and sponsor the Blue Jacket Fashion Show, along with the Prostate Cancer Foundation, for all the great reasons you just heard from Dr. Simmons as well. And, our goal is to continue to raise awareness of prostate cancer with very creative programs and initiatives that will help to reach a wider and a younger audience as well. And we are really proud to support patients that are most impacted as part of Johnson & Johnson's recent pledge to eliminate health inequities for people of color. So that also emphasizes why we're doing this.
That's fantastic, sir. So, Mr. Gillespie, I understand there's a way to donate to the Prostate Cancer Foundation to help fund prostate cancer research. How can people watching us today get involved?
Yes, Janssen Oncology, we're proud to support organizations that share our commitment, such as the Prostate Cancer Foundation, to developing life-changing cancer therapies for the people who need them most. So we invite those that are watching. A way to get involved is to visit the Prostate Cancer Foundation's website, which is www.pcf.org/Blue Jacket. And there you can go and you can make a donation towards prostate cancer research. And you can actually learn more about the work that the Prostate Cancer Foundation is doing to improve the prevention, detection, and the treatment of prostate cancer.
Thank you all very much for listening to us.
Well, that's a wrap. Thank you so much for joining us this year digitally. And I just have two simple words to leave with you. Get tested. See y'all all next year back on the runway. God bless. Oh, and before I go, I have one last thing.
Happy 5th anniversary Blue Jacket Fashion Show. And don't forget, get tested.
A huge shout out to the Blue Jacket Fashion Show for its 5th anniversary today. Really excited to be part of this digital runway this year, and I'm thinking of my grandmother who fought and battled cancer but is now in a better place.
Oh,
Well, prostate cancer is a serious problem, but we can address it through science.
Hi, Blue Jacket. Guess what? Congratulations on 5 years of doing amazing things. Thank you so much, and everyone get tested.
Happy 5th anniversary, Blue Jacket Fashion Show. Please make sure to get tested. It can save your life.